Hello, everyone. Thank you for joining us today. We are so excited to have you here for this important discussion. My name is Nicholas Vilminot. I'm the global lead for what we call the WASH sector for water, sanitation, and hygiene here at Action Against Hunger. And I will be filling in as the last-minute moderator as well as a speaker for today's webinar as Maria Pacheco from Storyful and a member of our advisory council couldn't join us today, unfortunately. So before we dive in, let me share a quick overview of the great work being done at Action Against Hunger. For over 45 years, Action Against Hunger has been at the forefront of the fight against global hunger through innovative solutions, community partnerships, tireless dedication, and we're working to save lives, improve nutrition, and build resilience of communities. Our ultimate goal is to create a world free from hunger. Today's webinar will take an in-depth look at how Action Against Hunger's integrated water strategies are transforming lives from communities in Kenya and beyond. From solar-powered smart taps to climate-smart agriculture, we'll explore how these solutions are reducing malnutrition and empowering local populations. So here's how our sessions will unfold. We'll start with a quick introduction and then presentations from our expert speakers, and then we'll follow it with a Q&A session where we'll address your pre-submitted questions. Thank you again for joining us to learn more about the power of water and innovation to transform lives. So let's get started. As I mentioned, I am the global lead for water, sanitation, and hygiene at Action Against Hunger. And I started working with Action Against Hunger in 2005, and I have contributed to humanitarian efforts in over 35 countries, working in many contexts from emergency response to long-term development effort. Being an advocate for multi-sector approaches to enhance equitable human development and climate resilience. We will hear very soon from Caroline Schender. Caroline is the head of department of our water, sanitation, and hygiene programs at Action Against Hunger in Kenya. She leads transformative initiatives bringing clean water access to the most vulnerable communities in Kenya. She champions innovative technologies and community-driven solutions for a lasting impact. And she specializes in developing sustainable water management systems that build climate resilience. And then we'll hear from Dancliffe Mbura. Dancliffe is the Communication and Partnership Manager at Action Against Hunger Kenya, with 14 years of leadership experience integrating nutrition, WASH, health, and climate change solution. He creates lasting impact through strategic partnerships and community-centered program design. He drives inclusive development initiatives that strengthen vulnerable communities' self-reliance. And Dancliffe will be our first presenter. So Dancliffe, I'm handing it over to you now.
Thank you so much for the opportunity, and thank you, everyone. Good morning, good afternoon. Just to start with our context is that Kenya is a country of over 55 million people, and with this, over 35%, which is close to 19 million Kenyans, most of them in the arid and semi-arid areas, what we call in the dry areas, are not able to access safe drinking water. So what do we mean by safe drinking water? This is water that is free from microbial, chemical, and physical contaminants. So which means that these 19 million people, their water is actually contaminated either with microbial, chemical, or physical contaminants. And the physical contaminants will be like dirt or objects that make the water unsafe. So which means that most of these people that we're talking about, they end up contaminating this water that is contaminated, and in most cases it leads to diseases. So most often the water from these open sources, like most of these people that I'm talking about, the 19 million people, they usually use water from the open services or sources like rivers, dams, and water pans. So that you see that if you having these open sources, then they're usually contaminated. So as you can see in that photo, you can see that that lady from one of the areas in Kenya, she's fetching water from an open source, and you could see that donkeys are passing there, so and they're also drinking from that. So that means that is one of the source of contamination. Next. So droughting and flooding is one of the leading environmental causes of poor water access and poor hygiene levels. So what happens is that due to the inadequate water access, usually people cannot be able to maintain good hygiene. So some of the hygiene practices that we know are like hand washing. So if you do not have access to water, then you're not able to practice hand washing. Sometimes it could be a shower or just taking a bath, so that most of the people do not have the water to maintain these hygiene levels. So this is sometimes leading to some of the diseases that such as cholera. So one of the things that drought usually leads to depletion of water, especially because of low rains. And as you can see in that photo, we have women fetching water from an open well, and that is because you see they're digging deep inside, because much of the surface water that sometimes they fetch has gone down. So sometimes it even becomes a danger to the women. And next. So as you can see in that photo, we have a dead animal. This is during the drought season. And one of the things is that during the drought season, you have a very poor distribution of rainfall that leads to poor pasture and poor access to water. So then this leads to a near collapse of the livelihoods of these people. So like in this community, when we went there, they had lost virtually like all their animals. So that really affects their livelihood. And when now the rains come, where this water, the surface water now runs over through these dead animals, the dead carcasses, and this ends up into the open water sources, like where there's that woman that we saw first, or the women that we saw first are fetching. So this also leads to the contamination of their water. Next. So during the flooding period, so we'll have most of the water sources are washed away. So most of the water sources here, we talk about the open water sources. So flooding will clear off, sometimes will fill up, or will sweep away those open water sources. Sometimes the infrastructure will be washed away. So you'll have these communities having again an issue. So if they have like a borehole, that borehole is submerged, so they're not able to access water. Even when they're accessing this water from this borehole, it's usually contaminated. So which means that during the flooding, when we expect rains to bring a good to ensure access to water, then sometimes it leads to inaccessible safe water. So one of the things is that Action Against Hunger Kenya operates in 7 regions in Kenya, which are primarily arid or very dry. And most of these counties, over 50% of the communities in these areas are not able to access safe water. One of the examples of these counties, we have one county in Baringo, this Baringo and Isiolo. And when I'm talking counties, these are sub-national, sub-government levels. Kenya has 2 levels of government, national and county. So in these 2 counties, actually, the problem is even worse. 75 and 69% of these populations are not able to access water. And then this also is made worse because in these areas, because of poverty and because of the climate changes and issues that have also escalated the poverty levels, you'll have these communities also do not have good sanitation facilities. So this is like latrines. So like in Baringo, 91% of the households do not have latrines. So that means the excreta, or the human excreta, actually is sometimes they dispose it over the surface, and when it rains, that it's washed now to the surface water where they access water, and this usually causes a lot of diseases. Thank you so much, and I hand over to you, Nicholas. Thank you.
Thank you, Dan Cliff. Now we'll hear from Caroline about what we actually do and what are the solutions.
Thank you so much, Nicholas. Good morning, good afternoon, good evening, everyone. As mentioned earlier, my name is Caroline Shanda. I'm the head of Department for WASH based here in Kenya. So as Dancliffe has mentioned before, looking at the context and the challenges that Kenya is facing, especially in the arid and semi-arid areas of Kenya, Action Against Hunger has been in the forefront to support the vulnerable community in terms of responding to emergencies while focusing on the long-term resilience of the community. First of all, the first phase of emergency response looks at immediate life-saving of the community, such as caused by floods, drought, or multiple shocks that we've been experiencing. So what are the key interventions we do in terms of emergency response? So we support the County Department of Water to do emergency water tracking. When you look at these as SAL counties, less than 60% or close to 40% of the population have access to clean water. So in other areas, there's inadequate or glaring gap in terms of water resources. So during peak of drought, we support the community to do emergency water tracking. We also ensure that we are also giving water treatment chemicals just to ensure that household consumption of water is safe, and we are also actually preventing waterborne related diseases. We work closely with the county government, the technical team, to ensure that during peak of dry season, they are able to repair those strategic boreholes, considering that this community are pastoral communities and depend mostly on livestock. So those boreholes that are close to migratory routes for livestock, we ensure that they immediately repair to ensure continuity of service delivery. And again, we look at during floods when the households are washed away and also the community do not have a sufficient sanitation facility. We also support the county government, the Department of Public Health, to ensure that we are constructing temporary emergency latrines so that we are able to contain the fecal matter so that it's not washed away into the rivers where some of the community are fetching water. Next. So looking at improving access to wash services, balancing between emergency response and building the resilience of the community, Action Against Hunger also supports ensuring that there's reliable water service at community level. So we work closely with the Department of Water and the Water Resource Authority to ensure that we are establishing water accesses in these communities through the drilling and installation of the solar-powered water system. And then we ensure that we are separating water for domestic use and also ensuring that every household at least can be able to access the water at any convenient time. So we do a lot of water kiosks or water communal points, reducing the burden of women and girls to walk long distances in search of clean water for domestic use. We also support rehabilitating the existing water system to ensure that we are improving availability and also improving the number of water points in the community where they have shortage of water. Next. So to be able to ensure that we are also focusing on improving economic empowerment and also improving water for productive use. For all the water points that we are, water points or boreholes that we are establishing or drilling, we make sure that we are supporting the community to be able to improve food security at household level. So we ensure that we are extending the water supply line to the farm or for small scale irrigation. So we work with farmer groups or the mother-to-mother support group within the areas where we are implementing so that the communities are able to establish what we call the kitchen gardens. They can be able to grow green leafy vegetables so that the children and the mothers at household level can be able to consume. And then the surplus of the vegetables or other farm produce can be sold so that they are able to diversify the livelihood at household level. Looking at these ASAL counties, at times the communities have been relying so much on rain-fed agriculture. However, since 2022, we've experienced the worst, Kenya experienced the worst drought, and we had a lot of community facing food insecurity. So that's why we are trying to ensure that we have sufficient water for domestic use, for livestock, and also for agriculture. We also support training of farmer groups on climate smart agriculture and ensuring that we are using water efficient irrigation techniques such as drip irrigation and also promoting drought resistant crops to ensure that we are balancing water for both livestock and domestic and also irrigation at community level. Next. besides improving access to water, we are also focusing on sanitation at household level. So Action Against Hunger work closely with the County Department of Public Health. So we work through the existing government structure, what we call the community health system at the lower level at community. So we basically train the community health promoters who are the key frontliners in ensuring that they are sensitizing the community in terms of latrine construction. So as Dancliffe mentioned before, most of this community practice open defecation, and we find the extractor finding itself or washed away into the rivers. So we are trying to prevent or to ensure that we are blocking the fecal matter being washed to the rivers. So we encourage the households to construct latrines. And with this, we ensure that we are working with the community using the locally available material. And most importantly, we use the model that the county government has introduced, especially at county and national government, what we call the community-led total sanitation. This is where the community take lead in terms of their sanitation matters and collectively mobilize the entire community so that we ensure that every village or every household have a functional household latrine with hand washing facility, so that we ensure that every member of the household, after visiting the toilets, they are able to wash their hands before doing any other household chores. Next. We've also seen in Kenya at health facility level and in areas where we are doing intervention, we have had a little funding going towards wash improvement in healthcare facilities. We've had a number of healthcare facilities lacking basic access to wash services. Some of them do not have latrines, some of them do not have access to water. So SCF has been supporting the government to bridge in the gap by conducting a thorough assessment with the County Department of Public Health to ensure that these health facilities do have access to latrines. So we've been doing a lot of construction of ventilated improved pit latrines in healthcare facilities, just to ensure that we are catering for the well-being of the healthcare practitioners who are working in the healthcare facilities, including the patients who are accessing services. This is to ensure that we are encouraging the community to get services at healthcare facility, so that we are not able to get the patients are not able to get the hospital acquired infection. Next. So besides constructing the latrines, we also want to do a lot of information prevention and control, and also do a lot of community awareness on hand hygiene. So we support also the government, the same health facilities, to ensure that hand washing facilities are constructed in strategic location within the health facilities, that anyone who is accessing the healthcare facilities are able to wash their hands. Anyone who is coming from the toilets are able to wash their hands. We are also ensuring that the hand washing facilities have the mural or the instruction on how to wash their hands step by step. And also we work closely with the community health promoters to ensure that they are also sensitizing the patients or the people who are accessing services at healthcare facilities in terms of good hygiene practices at the at household level. Next. We've also seen that besides the hand hygiene and latrine, there's lack of access to water in most of the health facilities at the community level. Some of the health facilities sometimes fail to give services due to that, and mothers have been forced to do deliveries at home. So SCF has been supporting a lot the government to ensure that in every health facilities where we have the delivery room, we are constructing the shower cubicle that the mothers can be able to bathe with dignity without carrying water from household to come and deliver at health facilities. And we've seen increased skill delivery at health facility after us supporting in terms of ensuring that we have access to health to wash in healthcare facilities. We work closely with the hygiene promoters to ensure that the water that we are supplying in health facility can be able to sustain the support, and we are ensuring that we are treating the water at the facility so that even the mothers can be able to consume the water while accessing services at the health facilities. Next. So with all the infrastructure development that we do, we ensure that there is sustainability of the wash infrastructure that we are putting up in the community. So how do we ensure that there is that sustainability? So we work closely with the Department of Water, the Water Resource Authority, and also the Department of Social Services to support the formation of the water management committees. So we capacity build the water management committee, who are the daily managers of water at the community level. This is the lower level of the government, the Ministry of Water, who from day to day operates and manage and ensure that there is 24-hour supply of water. So we capacity build them on operation and maintenance of the system. We ensure that any new installation that we are doing, they are able to manage and they are able to operate with the support of the county team from the government. We also work closely with the private sector to ensure that they are also there to give technical backstepping and also support in terms of ensuring that the spare parts or the equipment that is needed in case the borehole breakdown, it's available within the shortest period time. So for the county government, they are working at within 12 hours. If the borehole has broken down, they are able to respond and repair so that the community are able to access water. So again, to ensure that the community has self-reliance, we are able to install what we call the water ATM, or the prepaid system that enables the community to pay for the water. So this revenue that is collected is within the custody of the community, so that in case we have the borehole breakdown, they are able to access the funds and work with the private sector and the government, so that they are able to repair the system without external support. So we ensure all the infrastructure is well sustained and well managed by the government, the community, and also with support or the technical backstopping of the private sector. Next. So we also do a lot of hygiene promotion at household level, and also support distribution of NFIs. So this happens in two different scenarios. So during flood emergency, we support the IDPs who are displaced as a result of floods, to be able to have enough supply to store water safely. We also, in that kit, there is also what we call the water treatment chemicals, so that they are able to treat water at household level. And then during drought, we target the households that have children under the age of 5 years, or pregnant and lactating mothers who are malnourished. So why do we do that? We do that because we want to prevent the risks of waterborne diseases. And diarrhea is one of the leading causes of malnutrition. So that is the reason why we are targeting the malnourished children and under 5 to be able to prevent the water-related diseases, to ensure that we are not having these children back into the integrated management of acute malnutrition. Thank you, and I will hand over to you, Nicholas.
Thank you, Caroline. So drawing on these examples from Kenya, I wanted to zoom out on the big pictures, what Action Against Hunger is looking at for WASH as a global organization working in 56 countries. First, 0.5% of the water on Earth is available fresh water. And climate change is dangerously affecting that supply. It's also exacerbating crisis, as you've seen in Kenya. So over the past 50 years, water-related disasters, droughts, floods, hurricanes, epidemics, forest fires account for 70% of all deaths related to natural disasters. You may have heard a week or so ago that 2024 was officially the first year with the world temperature above the climate target of 2.7 Fahrenheit or 1.5 Celsius. That is considered a political target, not really a scientific one. So should we just move on to the next target then? Well, not quite, because what it means, especially for the communities with whom we work, is that by the time we reach the next target, 3.6 Fahrenheit, twice more people than currently are likely to suffer from water scarcity. So that creates humanitarian crisis already today, conflicts of usage between communities within a community, conflict between nations, difficulty to produce reliable food, increase in pollution, etc. So at Action Against Hunger, we dedicate a lot of our energy to respond to emergencies and humanitarian crises, to fight disease outbreaks, to support displaced populations. To do that, we deploy emergency systems, water treatment stations, water tankers, providing hygiene items for households, rehabilitating the damaged infrastructure, building new, more efficient water points. But I also want to highlight that while we focus often on the crises, which are increasing, the world has also made good progress in the past 25 years, improving the living conditions of people and in understanding and measuring the progress. Sub-Saharan Africa remains the region with the highest needs. Since 2000, we have increased by 20% what we categorize access to basic or improved drinking water sources. We've gone from 45% to 65% between 2000 and 2022. And so as the African population nearly doubled over that period, this translates to over 500 million people who gained access to water sources and who don't have to get water from the river or from the water point very far away from their home. Of course, we look at the empty side of the glass because there's still a lot that is needed. So we also work on long-term change by strengthening systems and institutions. In the world, 700 million people still don't have access to these basic water sources, and nearly half are in Africa. Nearly 1 billion people still lack safe and private toilets. So as I mentioned, we're also getting better at measuring our progress. We are realizing that providing water sources is not enough. Water needs to keep flowing, it needs to stay potable, and this requires resources and skills not always available to the community. It's estimated that 2.2 billion people in the world live without safely managed water supply, which means concretely that more than a quarter of the people in the world are at risk of some water contamination or some water disruption, not just when there's a flood every 10 years or when the main pipe bursts in the middle of the street, but on a regular basis, several times each month or even each week. This has consequences, as you've seen in Kenya, diseases, poverty, and timely death. You may have heard this before, including in Action Against Hunger's communications, a catchy number, easy to remember. 1,000 children die every day from diarrheal diseases. It's not only children. One person dies from avoidable diseases from unsafe water and dirty environment every 22 seconds. In 1990, when I was in middle school, it was one every 8 seconds, so that's progress, but that's obviously still not enough. The World Bank estimates that the world needs to spend an additional $140 billion each year on WASH to meet our commitments by 2030, almost double what we are currently spending as the world. Half of that missing money is needed for Sub-Saharan Africa alone, and it means increasing what we do 17 times. Let's say Action Against Hunger in East Africa. We currently have 110 staff like Caroline doing great job. What we need is 1,900 instead of 110, and not tomorrow, but yesterday, because the report was from a year ago. So it is urgent. So we work also with local governments, local communities, civil society organizations on the governance of the water resources, on sharing water, on extraction rights, on ensuring pollution sources are contained. We support local ownership of infrastructure to ensure it is sustainable. And who is responsible to monitor the water quality? Who is responsible to repair when there's a leak? Who's in charge of enforcing that toilets are built to the standards? Who can access bank loans and funding when an expensive pump or solar panels break down? Who pays for the water for drinking or for irrigation usage? How much? What is acceptable for people from different social conditions with incomes that may be tied to agricultural seasons? I want to make a plug here to talk about the engagement with the private sector, not just large companies or philanthropy, but small-scale, local private sector are essential to provide services that need to be supported to grow into difficult market segments, shifting into a customer's mindset, setting reasonable prices for water, for latrine construction, or to empty toilets that are full. Hopefully, you have on the screen now a picture from a proud entrepreneur who we supported a few years ago in Cambodia to expand his local masonry business into selling affordable but desirable toilets, promoting his offer to customers and growing demand for his services. Finally, I will close by mentioning that Action Against Hunger is always trying to find better ways, more efficient, more impactful to the problems. So we conduct research to generate evidence, to improve, to innovate. For example, we research on how malnutrition and WASH are connected so that we can improve the treatment to save more children and to understand how to better prevent it in the first place. We research what helps people sustain behaviors like washing hands. We are currently looking into how we can integrate AI into how we disseminate the wealth of knowledge that we have accumulated, and much more. So with that, I thank you very much for your interest and your support for our work, and we will move on to a series of questions for the panelists. So I would start with you, Dancliffe. So climate change has a large impact on water issues, as we've discussed. And so effects of climate change are felt in Kenya. What impacts do you and the local communities witness? And how do you adapt your project to respond to those needs now and for the future?
Thank you so much. So one of the things that is happening is that with the climate change, we have seen different weather patterns from what used to be before. So one of the things that is coming out is a lot of prolonged droughts that are coming that are being experienced in Kenya. So like in the 2022-2023, we had a very prolonged drought where we had more than 5 failed rain seasons. That has it's like over 40 years that we had such an incident. So what happens is that of course most of the communities have their livelihoods almost collapsing, especially those who depend on rain-fed agriculture or livestock rearing. So after that, then of course you'll have very high levels of malnutrition, of food insecurity, then malnutrition. Then of course, then this is where we need to come and provide support to the communities. So of course, to avert the deaths and also to support communities, what we do is that we ensure that we come out to the partners, to the donors, to everyone, including the community, to come and support those people in need, to ensure that we are giving them dignity, we are providing the food, in cases sometimes cash transfers, and what Caro has indicated is in WASH becomes one of the biggest issues, ensuring that they're able to access water for themselves and for the animals. We had in this drought, in some families, they lost over 80% of their livestock. Then what does that mean? These people sometimes cannot do anything because they have lost virtually everything. Sometimes they lose the productive assets, like the lactating animals, livestock, or the cattle, so they're not able to access milk. So then what happens is that we need to come out and provide that support. One of the another effects of the climate change is that we've had unpredictable seasons. Sometimes you have rains that is very erratic, rains that is coming in torrents, very big rains that is at a very short period of time, then it causes flooding, and then of course the seasons, because there's altered seasons. So farmers are now kind of confused. So you don't know when to plant, when to do what. So then it leads now to, of course, issues with livelihoods. Communities are not able to participate in good livelihoods. And sometimes, as we said, whenever the flooding comes, then they've washed away their infrastructure. So like in some instances, you have communities that trade together who have a bridge somewhere, then it's washed away. Then you have communities not able to communicate, not able to participate in livelihood activities. Then, of course, here we have to come in sometimes, even advocate to the government to ensure that some of this infrastructure comes aboard. But of course, it's also it's a toll to the government and partners, because when this happens, then you have to shift some of the funding resources. Then you have to shift them to response. Another is frequent diseases that are coming around. This is another big issue, because we're having a lot of outbreaks of diseases, sometimes because of flooding, sometimes because of reduced immunity, because of food, people are very malnourished. Then as a partner, we come to support the government sometimes to provide support for responses whenever there are outbreaks of the diseases. Like we have had frequent outbreaks of cholera, then we have to provide support, look for the money, and ensure that we are reaching those children that otherwise will die in very severe cases times. So this is some of the effects of the climate change. And what we are seeing is that this is becoming more and more. So there's need for more support to the communities, especially trying to build the resilience and providing especially water boreholes so that they can support themselves and win them off the humanitarian support. Thank you so much.
Thank you, Dancliffe. Caroline, context like Kenya is considered a lower middle income country by opposition to more fragile and unstable contexts like your neighboring countries in Somalia or South Sudan, leading to more development programming, stable government institution, private sector. How does that reflect on the work done by an organization like Action Against Hunger in Kenya?
Thank you so much. That's what we are getting to hear. However, when you look at the regional population or disparities, if you compare the urban and the rural areas, Kenya has around 47 counties. But out of these 47 counties, we have 23 counties that is in the ASAL or arid regions that continuously faces drought, floods, or the climatic shocks. So what does that mean? So Action Against Hunger normally do response targeting those areas, those pocket areas where the community have challenges in terms of accessing services. So we work closely with the government to strengthen their system, what we call system strengthening. Kenya has a very strong structure. We have the established structure that we can work through. So besides providing emergency response, we are also building the capacity of the government to be able to sustain the gains that we have already made as Action Against Hunger. We also work with the private, we take advantage of the private sector through the private partnership, so that they are able to come in to offer the technical support. We also capitalize on what we call the community social responsibilities, so that while giving emergency response, we are also focusing on a development aspect, what we call the humanitarian development nexus, so that we transition the community and we are able to build their capacity. When you look at the country strategy, our country strategy in Kenya, we have two strong objectives. Objective one is about saving lives, and strategic objective two is about building the resilience of the community. So we work closely to ensure we adapt to the changing scenario and the context, so that we are able to support the community as well as the government to ensure that the systems are strengthened to continuously offer the support. So we're also looking at not doing the direct implementation, but also working with the local partnership so that we are also transferring knowledge so that we already have these gains made at the community level. Thank you.
Thank you both. There are many other questions in the chat that we will try to answer. Unfortunately, we are already at time, so we will do that offline. But thank you very much all for joining today, what I hope has been an insightful and engaging webinar. I hope you found the session valuable and you are leaving with fresh ideas, perspectives, and tools. Special thank you to the speakers, Caroline and Dancliffe, for sharing your experience and expertise. Before we wrap up, I would like to let you know that this webinar will be available on the Action Against Hunger YouTube channel in just a couple of days. Webinars like this are made possible thanks to the support of viewers like you. Please don't forget to complete our survey. Your feedback will help us continue to improve and deliver meaningful content for future webinars. If you have any further questions, feel free to reach out to us at info@actionagainsthunger.org. On behalf of the entire team, thank you again for your time, your participation, and your support to our organization. Stay safe and take care. We hope to see you at our next webinar.